is hard. Immunity is a little bit more complicated. So basically, I'm telling you that you next week when we're on spring break, you got to start studying because that's will be the exam 3 will be on this. Like any system, we're going to talk about. We have to know its function, and you know, very important to appreciate that if this is the capillary, and you know, in hemodynamic or basically blood flow capillary, and you see if this is the arteria end and this is the vena end, and you saw that filtration occur here, right? And you saw reabsorptions occur here. So one of the function of the lymphatic system is to bring this interstitial fluid, right? Interstitial fluid is in the um, between the cells and the tissue. This is known as interstitial fluid going back into the lymphatic. Okay. And they're also considered as lymphatic capillary, which is small. Um, so that's one function of the lymphatic is to bring the interstitial fluid back to the general circulation. And very importantly, that um, the the lymphatic capillary is a little bit different from this capillary because the capillary of the cardiovascular system typically do not allow large particle like red blood cell, white blood cells, and albumin to leave, but small molecule can pass through. The lymphatic capillary, on the other hand, has a one-way um, I don't know what you call these valve. I guess you can call it valve, but allows us not only fluid but cells to enter into the lymphatic. But not only cell, also pathogen, also parasite, right, to enter this. In fact, the original cell that was identified within the floating around these cells in the lymphatic, hence their name is lymphocyte. But now we know that lymphocytes are also found in the blood as well. Okay. But previously I told you that if the filtration rate is about 14 mLs per minute, and the reabsorption is 12 mLs per minute, right? What happened to that 2 ml? So the 2 mLs per minute is, that fluid is, exit, if you will, or removed from the interstitial into the lymphatic. But if you have, let's say, a parasite that blocks this, guess what? You're going to get fluids accumulation. Okay, you're going to get edema. Okay, that's edema. And here is an example of what happens if you interfere with the lymph flow. Okay, and this picture was taken from a man who has in this country is endemic, right? So the word endemic means you can find out a lot of disease in that country, right? So we say that this condition known as elephantiasis, and it's caused by a parasite, Wisharia bancrofti, is endemic. For example, in certain African country, it's a parasite, and it's transmitted by mosquito. And what it does is that the parasite will enters the lymphatic vessel, capillary then vessel, and then it interferes with the lymph flow. So the lymph flow cannot flow anymore, so that interstitial fluids accumulate, and consequently, you can see that here, his scrotum is getting really big. A lot of times, the trunk of the leg will get really big. And then when I told the student that, the guy's ball is so big that he has to use a wheelbarrow to push it around, the student laughed, right? He's like, oh, that's funny, but yeah, it exists here. Um, so endemic meaning that, certain number of cases per year. So let's say you have you can say, you know, um, influenza or flu is endemic to the US, but each year you may have, say, 1.2 million cases. When there's an increased numbers of cases per year, so let's say in 2019, there is 2 million cases of influenza, for example, higher than normal. So we call that epidemic is broken out, for example, right? And like you can say in 2019, there is very few cases of coronavirus or severe respiratory illness, right? And then in 2020, now you get like, over 1.2 million, higher than the normal rate. So we can say that, oh, that's an epidemic. And then when every country started to have this endemic or the disease have traveled across countries, you can say that as pandemic, the word pan meaning across. Okay, so endemic, epidemic is increased number, and then pandemic meaning across, meaning everywhere across countries. So endemic to this country is this disease known as elephantiasis. Okay. Uh, and it's I don't think you guys really need to know this. It's just that how you know because it's very important. I spent almost 3 months in Sri Lanka studying the dengue virus and how dengue can cause dengue, and it's also transmitted by mosquito. And the idea here is that in a lot of country, if you don't control the mosquito, you're going to get vector-borne, in this case, mosquito that's transmitted disease, right? You can get things like malaria, you can get like dengue, chikungunya, Wucheria bankrupti, like you see here. Um, in Sri Lanka, is always, their dengue infection rate seems to be increased right after the rain, for example. And that's because if you don't have a good irrigation system, such that when it rains, now you have puddle around, instead of having water drainage out into the water treatment, that standing water is a reservoir for the mosquito to lay the eggs, and hence the parasitic infection. All right, so that's all I'm going to say is about that. And so all these network here that you see, that is the lymphatic vessel. Okay. All right. Lymphatic system and immunity. Network of vessel that assisted in the circulating of fluid. Unlike the cardiovascular system where you guys have 5 liters of blood and it flow within this, well, the lymphatic system is not a closed system; it's an open system, so you can have more fluid enter it, or usually it starts at the like a blind end pouch or something like that. Okay. And we mentioned already that is transport excess fluid away from the interstitial. And once that fluids get into the lymphatic vessel, it then bring it to the general circulation. And because there are immune cells, particularly lymphocyte, that is travel in this, it also helps to defend against the disease. Okay. All right, so here is, unlike the cardiovascular system, which is a closed system, so that if you have a nick in a blood vessel, blood can just flow out, and that's dangerous. Thus, you have to have hemostasis mechanism to clog that, and hemostasis including vascular spasm, platelet plug, and coagulation. Coagulation has both the intrinsic, extrinsic pathway, leads to factor 10, leads to activations of the thrombin activator or prothrombin activator, which converts prothrombin to thrombin, thrombin convert fibrinogen to fibrin, and then you form a clot. And the downstream of that is plasmin, which is to remove the clot. Now, the lymphatic system is at the blind end, you see here. So that interstitial can flow into the capillary. But here's a good to remember, and I'll guarantee you, you will see this exam question. This question is an exam, okay? In which how you look at the lymph flow, right? So rather than to say, okay, you know how blood is travel in the arterial system and then in the venous system, okay? So blood is traveling the cardiovascular system, but lymph is flow in this lymphatic system. And lymphatic systems start out with beside lymphatic capillary, okay, that's you want to know. Lymphatic vessel first. And there are many, many different vessels. So this was vessel, right? These are all vessel, okay? Now coursing along the vessel is a lymph node, right? And then these vessels will merge to form different lymphatic trunk, right? And the trunk could be the mediastinum, the abdominal trunk, you know, and then from trunk, it goes into the lymphatic duct. And you only have two types of lymphatic duct. One is known as the right lymphatic duct. And the other one is known as the thoracic duct. Okay. So in the future, if I say, okay, what is the directions of the lymph flow, and you need to know them, is to think of them as in V to T to D, right? It's in alphabetical order, but reverse. Right? So if you see my future exam, or if you have tests, one of my tests from the past, I just warn you regarding selecting the answer choices, but always relies on VTD. Okay? That's the way that lymph flow. Now, there are two ducts. One duct, you know, interestingly, the cardiovascular system that you see here is pretty much mirror image, and that is, if in the thoracic aorta, for example, you may have some left intercostal artery, right intercostal. Okay, they're very symmetric. And then if you go into the abdominal aorta, beside the celiac trunk, if you have, let's say, you know, the left renal artery and the right renal artery, right? They're kind of like similar placed. The drainage, however, is different between these two ducts, right? The right lymphatic duct is actually take drainage from the right side of your head and the right arm, and you know, the upper right torso, all goes into the right lymphatic duct. But drainage from the right leg, left arm, left torso, left head goes into the thoracic duct. So 3/4 of the body goes into this major duct called thoracic duct. Mm. So keep that in mind. One, know the lymph flow, and two, different kinds of duct. All right, so here you can see how the capillary now, this is before the vessel, the capillary is blind in, it's closed in, and these has to be anchors down, otherwise the interstitial fluid can cause this thing, push fluid in, cause it to collapse if it's not anchored down. So they certainly are anchored down. And any interfere with this lymph flow can cause this elephantitis, also known as filariasis. Okay. And also in the future, if I ask you, what is the lymphatic vessel, will look similar to what structure of the cardiovascular system? Is it veins or is it artery, right? And the correct answer is always going to be vein, right? Do we know what are the three mechanisms that allows veins to flow in the allows blood to flow in the venous circulation? What are the three mechanisms that allows blood to flow in the venous circulation?
Vas.
Mhm.
I think the valves, skeletal muscles, and thoracic pump.
Yeah. So I think all the answers are there. One is because a vein has valve, which is prevent blood from, once they flow toward the heart, it doesn't flow backward. Two, skeletal muscle contraction, sort of like massage the vein, and the thoracic pump. The changing the thoracic pressure put the sort of like pressure on the superior and inferior vena cava, right? In a similar way, those three mechanisms allows lymph to flow, right? The reason why lymph flow and it flows upward toward the subclavian veins. So in other words, either thoracic duct or the right lymphatic duct, they're all going to drain into your subclavian vein, right, which is under the clavicle. And blood in the subclavian vein is going to, drain into the brachiocephalic vein, also known as the innominate vein. So the right brachiocephalic vein, the left brachiocephalic vein, all drain into the superior vena cava. Okay? So I think by now you guys should learn about the blood vessel and think of how blood flow in the artery and in the arterial system and the venous system. Okay, so here is a picture, a micrograph of the lymphatic vessel. And what the arrow is pointing to is the fact that the lymphatic vessel also have valve as well, okay? And these valve will prevent the lymph from flowing backward. So once they flow toward the subclavian vein, they don't flow backward. And they're also composed of these three layers. The inner layers, because of the inner lining, endothelial cell, the smooth muscle metal layer, and the connective tissue of the outside. We don't really call them as tunica interna, tunica externa, and tunica media because that's really refers to blood vessel. It has very thin wall-like veins. And usually these large vessels will drain it into the lymph node. And one of the function of the lymph node is to filter the lymph, okay? Filter the lymph. All right, so lymphatic vessel, lymph in lymphatic vessel will flow into the different trunks. And here are different trunks. And I'm not going to ask you to know different trunk, but other than to know that lymphatic vessel all drain into the different trunk. The lumbar trunk down here, the intestinal trunk, abdominal trunk is up here, intercostal is, between the rib, bronchomediastinal trunk, subclavian trunk, and jugular trunk, right? There you are. But what happened is that these trunks, right, will drain into two ducts. And the two ducts are this one up here, which is called the right lymphatic duct. And then this one right here is known as thoracic duct. If you want to say the thoracic duct starts at the cisterna calli, which is here. Cisterna calli was a little enlarged beginning of the thoracic duct, and it ends in the left subclavian vein, for example. So this will be your left brachiocephalic vein or the left innominate vein. Here's your right brachiocephalic vein or the right innominate vein. Both of them draining through the superior vena cava. And the reason why this is known as a brachiocephalic vein is because it actually takes drainage from the brachial, which is the arm, right? And the cephalic is the head. And here you have, it's not the carotid. The carotid artery is arterial system. So here's known as jugular. You have the internal jugular, which is oftentimes bigger than the external jugular. And the internal jugular drain from the inside the brain, whereas the external is on the outside. In cat, it will be opposite, by the way, since we're not going to do cat, so you don't have to worry. All right, so this shows you a nice comparison between two different ducts. And you can see this kind of highlighted, this region here. All that drains into the right lymphatic duct, whereas the rest of the body, the right leg, the left arm, all drains it into the thoracic duct. You can see here, all right? There are many kinds of lymph node, okay? So typically what a lymph node does, and say this is the lymph node, and you may have many lymphatic vessel that goes into the lymph node. Okay. So when a vessel bring in something, it's also known as afferent. So this would be considered as the afferent lymphatic vessel, and the one that is bringing the lymph out is known as the efferent. So this is known as the efferent or efferent lymphatic vessel, right? So E stands for exit. Now, the lymph node has many area that is this area that's sort of like have a lot of B lymphocyte. Okay, so we start to learn about blood, and you can say how blood is has those 5 white blood cells: your neutrophil, your lymphocyte, your monocyte, your eosinophil, and your basophil. Well, lymphocyte, there are 2 kinds. There are B lymphocyte and T lymphocyte. So start learning these cells. Okay. B lymphocyte and T lymphocyte. And they have different function in the immune system. But for now, the B lymphocyte, this one B, usually you see a lot in this lymph node. And this concentric area known as the germinal center. Okay, so all of this is known as the germinal center. Okay, now that's going to be important. We're going to see a little bit, but one of the functions of the lymph node is to to filter, but it's also an area where really body first encounter any pathogen that potentially invade your body. We're not talking about surfaces like epithelium, right? And you know, maybe this is important when we talk about the immune system, and that is, if you look at the respiratory tract, the um, the digestive tract, the urogenital tract. So, that's urogenital mean the urethra, for example, that is important for the urinary system. But the male urethra is also important for the reproductive system. So we call it urogenital tract and the skin. These are the four areas that tend to have a lot of infection. Why? It's because they're exposed to environment. Typically, the skin is outside, right? It's exposed, but actually, when you're inhaling something that goes in, right, in your body, while it's in the body, it still considers out of the body because it hasn't gone through the respiratory membrane, for example, or hasn't gone through the wall of the respiratory tract, for example. Likewise, if you ingest something, something is in the lumen of the esophagus or in the stomach is really not considered inside your body yet. Because if you swallow a marble, you can certainly pass out that marble, right? But once they have absorbed it to the small intestine, for example, then it be considered into your body. Now, the fact that mosquito is dangerous because when it's delivered a parasite, it directly goes into the skin, for example. It bypasses that layer, so it penetrates or can get into your blood really easily, or it can get into the interstitial fluid. And if it does get into the interstitial fluid, and it seems like this is the cell, this is the place where the immune cell first encounter the parasite that invade your body. And we're going to see a phenomenon is known as clonal expansion. And that is within the germinal center, these B cells, and you have roughly about 1 million different B cells. And these B cells have different receptor on its surface. But any B cell that have the right receptor that recognize the pathogen, for example, is selected to expand. And when they expand, the germinal center will get really big. Okay? And if the germinal center will get really big, the lymph node will get big, right? So we call that lymphadenopathy. Adeno refers to glandular. Apathy means disease. So you have enlarged lymph node. Now, the enlarged lymph node, you probably have, whenever you have an infection in the, lower extremity, like your foot, for example, your lymph is going to drain from that, potentially carrying pathogen, and it goes up into your inguinal lymph node. And because inguinal lymph node is near the surface, you can palpate. That's a good word to know, is palpate. And when you palpate, mean you can feel. And if it's enlarged, that means you have an infection, if you will. And that's also pretty true, is that you have a sore throat, for example, the lymph node, cervical lymph node might get enlarged, for example. In this case, what you see here is that what happened is that a lot of cells of epithelial origin, particularly cancer cells, and how they spread throughout a different part of our body, known as metastasis, they can enter into the lymph node and then started to metastasize, mean go to other distant organ like the lung, the bone marrow, and so forth. So if we find a woman who did self-examination and felt a lump, follow up with the mammogram and saw that it's still light, then it could suggest cancer. And in staging, what we want to do is you want to know whether the cancer cell has been spread to the nearby lymph node, right? And so basically, you will remove these lymph node and examine whether there's cancer cells there. If it's there, then it suggests that it has been metastasized. So we call that stage 4 cancer, for example. Um, Stage 3 or 4 depends on how extensive the metastasis is. If it's lymph node negative, well, that's great because you can either do lympectomy, which you just remove a little bit of that area, or if you want to be safe, you can remove the whole breast, like mastectomy, for example. But here in this context is that cancer cell can certainly enter the lymphatic system and migrate to the different site, and they will reside in the lymph node. And by biopsy, the lymph node, you can tell whether uh, it gone through metastasis or not. So in staging, we say, oh, it's usually we define them as TNM. Probably not important for you guys, but if you guys interested in taking pathophysiology, staging is requires on these three important parameters: the tumor size, node positive or not, and metastasis. You look at is it finds in the lung, the bone marrow, um, or the liver. Those are the three metastatic sites, common metastatic sites. All right, again, so the lymph passageways, you can say from capillary into lymphatic vessel. By the way, is it okay? I know you guys are tired. So I'm going to go maybe another 15 minutes and we end it early at 8:30. And then we can pick up next time we meet. Okay, good. All right. Lymphatic vessel, these were considered as afferent. We'll bring it in to the lymph node, and from the lymph node, it's going to go out. What I didn't also tell you earlier is that there seems to be more afferent lymph node than efferent lymph node. Afferent, I am tired too. Afferent lymphatic vessel. Okay, and this is efferent lymphatic vessel. Right. So then, in other words, you get more fluid going in lymph than fluid going out. What does that mean? That means that the lymph is going to linger around here, which is great because then it allows us the B cell to monitor that, right? This is just your basic traffic. If there are three lanes on 495, but because there's an accident, now they have to close 2 lanes, and you can see a backup of cars, right? Because only one car can pass at one time. That's exactly the similar thing. That more afferent lymphatic vessel brings the lymph in than there are efferent lymphatic vessel that brings the lymph out. As consequent, there's going to be a backup of lymph, which allows them the B cell. Okay, and B cell, now you guys associate B cell is part of the cells involved in adaptive immunity. So next time when we're talking about immunity, you can say, well, there's two kinds. There is innate immunity, and there's adaptive. And the stronger one is this one, adaptive. Okay? The innate is the weaker one, but it's very protective, like the skin is innate. The adaptive is what we want, right? So the reason why you want to get vaccinated is you want to have a build a strong adaptive immunity. The word adaptive means it is adapting to that one specific pathogen, right? So with the coronavirus, it's very specific to SARS, SARS virus 2, for example. SARS stands for severe acute respiratory virus. And we want it to be very specific to that, okay? And the B cell are found abundantly within the germinal center again. And when the B cell, they have the right receptor for that, um, they are then selected to expand and to proliferate, and and that's where you can get an enlarged lymph node. All right. Now, lymph flow from lymphatic vessel into the lymphatic trunk, and from trunk into the duct, and then it goes into subclavian vein, right? So if you know this order, you'll be okay. Okay, so that's again, no matter how I ask the question, the order is going to be like this. That's all. Lymph is just basically that come from the interstitial fluid, and that's what flows in the lymphatic capillary and lymphatic vessel. It's, of course, interstitial fluid also come from plasma. And I told you already that all of the fluid in our body is connected, whether it is from the interstitial fluid to plasma, extracellular fluid, intracellular fluid, they're all connected. In this case, lymph come from plasma, which get filtered at the arterium, the capillary, and then it goes into the lymphatic capillary. And usually, the wall of the lymphatic capillary is different from the wall of your continuous type of capillary, and that is, it can allow for proteins and even cells to enter as well. Okay. Okay. So lymph formations certainly come from that interstitial space. And if you prevent that, we already saw that lymph flow can lead to edema, right? Another important function of the lymph is that, one of the areas that's involved in major absorptions in our body is the small intestine. And the way that if the small intestine is involved in the absorption, oftentimes it has a lot of these folding that go inward like this. Okay, this is known as the villus or villi, and these villi are composed of cells, and there are many cells that forms the villus. And another way that these cells can also increase the surface area is to have microvilli, okay, that extension from that. And of course, if this is the small intestine, the drainage from the small intestine, right? So in other words, if you eating something and you're absorbing the food through the duodenum, most of the food is going to the superior mesenteric vein. And blood from the superior mesenteric vein will go into the hepatic portal circulation, hepatic portal vein, which then hepatic portal vein bring blood into the liver. And once it's processed that, the liver can dump that into the hepatic vein, which then goes into the inferior vena cava. So that's the key difference between hepatic portal vein, which is bring the blood to the liver, right? Whereas so let me do this. So let's say here's the liver, and here's your inferior vena cava. And so most of these right here, superior mesenteric vein, will brings blood, right, into this is known as hepatic vein. Sorry, hepatic portal vein, which bring blood into the liver, and the liver processes that, and it brings the blood to the inferior vena cava. Via this is the hepatic vein. Okay, so hepatic portal vein bring blood in. Sorry, bring blood in, right? And this one bring blood out, hepatic vein. So that's the key difference. But another important thing is this, that under this, right, there's another system or vessel. I guess you can say vessel. This is known as the lacteal. Okay? The lacteal is part of the lymphatic system, and the lacteal, which is important, is because the word lac refers to kind of like milk, right? Which is kind of like white color, right? Like milk. Now, that's where initially how they discover it and say, oh, it's white, it looks like milk. But it's really when your diet has a lot of fat, dietary fat, the fat is then absorbed to the lacteal system. It's going this. And once you get into the lacteal, this system is bypassed, right? You don't go through that system. In fact, as the part of the lymphatic, it's going to go to that, intestinal trunk. An intestinal trunk into the thoracic duct, and then thoracic duct into the subclavian vein. And so dietary fat get into your body much quicker than water-soluble food, for example. So in that context, you can say, well, there are some drugs or some vitamin that is fat-soluble. If it's fat-soluble, it's going to absorb through this system, but not water-soluble. If it's water-soluble, it goes through this system, okay? But fat-soluble, also the key here is that the lacteal, okay? Lacteal absorptions of dietary fat and deliver fat to the bloodstream. Okay, so as you can see here, there are how the interstitial fluid can flow into this the blind end of the capillary and composed of endothelial cell. There certainly are filaments that anchor these in place. Otherwise, too much pressure can, just imagine this is balloon. If you don't hold the balloon down, it's just going to crush, for example. And you can see here are the anchoring filament. But you can see here how anchor filament, how the wall of the capillary, they have a lot of big opening. So then now you not only you have protein that can go through here, but you can also have white blood cell that is traveling here as well, and definitely that parasite that can enter here, and then or viruses of fungi can always go here as well. We saw that with the parasite Wolschuria, and that caused that interfere with the lymph flow, and it could causes elephantitis. We talked about already how the lymph movement, what causes that to flow, action skeletal muscle, respiratory movement, also known as the thoracic pump, and then the lymphatic vessel have valves to prevent it from flowing backward. Okay, now there are different kinds of lymphatic tissue and lymphatic organ, okay? So next time, what I'm going to do is that I'm going to start with this slide, which tell you the difference between lymphatic tissue and lymphatic organ. Whenever we talk about an organ, we are referring to the lymph node as an organ, the tonsil is an organ, the thymus is an organ, the spleen is an organ. It's an organ because it has a nice connective tissue surrounding that organ. There are other lymphatic tissue, okay? It's not considered organ because it doesn't have the capsule. And what are some of the lymphatic tissue? Okay. Some of the lymphatic tissue often associated with the mucosal membrane, okay? So we call them mucosal associated lymphatic tissue, right? So mucosal meaning that it has goblet cell, or in general we call this as mold. Okay. For mucosal associated lymphatic tissue, and that is any type of epithelium that has goblet cells that secrete mucus will have this. Underneath the muscle layer is a cluster of immune cell, okay? And we call it that as mold. Or if it's associated with the bronchus, right, it's known as bolt, for broncho associated lymphatic tissue. And then, of course, there are also a cluster of immune cells just sit underneath the muscular externa, in the above the muscular externa, but underneath the mucosal, right, in the submucosal of the small intestine, for example, and this is known as Peyer's patches. Okay, so these are the three, we would say, lymphatic tissue, and they're considered lymphatic tissues is because they don't have capsules around them, right? Lymphatic tissue. Okay, so next time we're going to talk about lymph node. I kind of talk about lymph node, but we could say which one that's palpate or not. We're going to talk about tonsil, then we'll talk about thymus. Suffice to say the thymus is very important for T cells development. So T cell here refers to T lymphocyte. Okay. So without the thymus, you don't have mature T cells development. And B cells and T cells are very important cells of the adaptive immunity. Okay, and then we'll talk about the spleen. All right, so I'm going to stop here and